Understanding Autism with Dr. David Willis, President of the Oregon Pediatric Society and the Medical Director of the Arts Center for Developmental Health.
Autism is a lifelong disorder that affects a child's development of social and communication skills and is often accompanied by unusual repetitive behaviors. The cause of this condition remains unknown. Autism, like many other childhood disorders, appears to have increased in incidence within the last 20 years. It occurs before the age of 3, and some children appear to be affected from birth, whereas others seem to lose skills around 15 to 18 months of age. Autism more frequently affects boys than girls. Diagnosis relies on history and clinical findings that match the DSM criteria, and at this time there are no specific lab tests that confirm the diagnosis, although some genetic testing has had some merit. The American Academy of Pediatrics is now recommending routine developmental monitoring, including routine screening of all children for autism at 18 months and 24 months, using validated screening tools such as the MCHAT or the CHAT. Parents may report early warning signs, such as their child appearing deaf or having lost words or social skills that they previously had. Children with autism pay little attention to what is going on around them, and they often appear to be trapped in their own world. They may not even attempt to make any communication or to be social, even with their own family. They may avoid eye contact. They may often have limited or no words or have language that only their parents can understand. They may not gesture, such as waving or pointing, even for things they want. Instead, they sometimes use hand leading, but often there will be no initiation or communication interactively. Children with autism characteristically may engage in repetitive behaviors for hours every day and become very upset when they're disrupted and interfered with. Some become absorbed in self-stimulatory behaviors such as spinning the wheel of a toy car or lying on the floor and just moving the car back and forth for extended periods. Sometimes they'll line up toys in extended lines without actually playing with them. Children thus play with toys differently than typical children and do not play with toys in stories or in play activities. Many children with autism also have sensory issues that affect them on several levels. They may have very strong skin sensitivities that cause them to be strongly resistant to bathing, haircuts, and having their nails clipped. Additionally, they may not tolerate the labels in their clothes and are uncomfortable with certain items and garments. They may have strong sensitivities to common household smells and noises, and frequently may cover their nose or ears when they become uncomfortable with these particular sensory experiences. Such events as birthdays or holidays can also be extremely difficult for them, when the excitement and the sensory overload may cause them to have temper tantrums and meltdowns. Many children with autism also have motor issues. They may have deficits in fine motor skills, balance, or coordination. These weaknesses can make typical play very difficult, and they tend to be much more playful in their minds than they are with their bodies. Children with autism also can show self-injurious behaviors, like hitting themselves or biting themselves, or some other aspects of hurting themselves that can be very difficult for their parents and caretakers. Safety is also a major concern, since often the child shows absolutely no sense of fear or danger. They may not recognize things that could easily hurt them. Many children with autism also have other coexisting medical conditions, including seizures, sleep disorders, abnormal pain responses, and gastrointestinal problems. The GI disturbances can include diarrhea, constipation, abdominal pain, and reflux. It's very important to provide comprehensive medical care to help identify these coexisting conditions so they can be adequately treated, bringing both relief to the child and to the families. It's essential that autism is identified early and that interventions begin as soon as possible. Studies have shown that early, intensive educational interventions result in improved outcomes for children and their families. The challenges of autism are lifelong, both for the child with autism and their families. They do require multiple treatment approaches and intervention teams committed to improving the child's capacity over the years. However, with intensive and comprehensive efforts, especially early, we're now seeing significant and important improvements in the skills, the learning capacities, and the social communication that gives the child, their family, and the community the much-needed hope. a child at risk for autism should be referred to other developmental specialists for thorough evaluation and treatment within their communities. Thank you.